Hi there. In this video I'm going to show you some lovely techniques to mobilise your thoracic spine. Now in case you're not sure, your thoracic spine makes up essentially your torso. It's comprised of 12 vertebral segments which start off just below the neck and finish just above the lumbar spine. It's a part of the back that can get very stiff. Typically there's a lot of hunched forwards activities these days, at your office, computer, driving, whatever it might be. And your spine will rest and sit in that flexion curve, and we need to try and extend and arch the spine backwards to increase the mobility and act as a counter position for that hunched, rounded, shoulders forward, chin poking, horrible posture which a lot of people will fall into these days. I'm going to be using a roller combined with the Pilates key elements. Don't worry if you don't have a roller just like this. Any type of foam roller will do. And if you don't have something like that, also don't worry, because you can use pillows, rolled up towels, exercise balls and the like. And I'll talk through lots of those variations at the end of the video, because the same principles are employed regardless of what you're using as the object for the stretch. So we'll get going, and this is a great exercise for mobilising your thoracic spine, but it also therefore serves as a great exercise to do prior to any Pilates exercises which rely on you being able to extend. So we're thinking about exercise on your front, like a swan dive or a breaststroke prep or the actual breaststroke, ones which need you lifting your torso off the floor into that extension pattern. This serves as a great warm-up. So there's a number of ways you can utilize this, but I think it's a great set of techniques, and hopefully you do too. Now what we're going to do for the sake of this exercise demonstration is to split the thoracic spine into upper, middle and lower. And particularly if you've not done this sort of thing before, you'd always want to start with the upper thoracic spine for reasons which will become evident in a moment. So I'm going to take my roller, and remember you can use whatever object you have at your disposal, which I'll talk through at the end. You place the roller perpendicular across my mat so that I can then roll onto my side just in front of it, and then over onto my back into a bent knee position, and the roller is now sitting at the base of my shoulder blades. From there I'm going to support the back of my head with my fingers interlocked and have my legs akin to a rest position, feet, knees hip width apart and in a comfortable state of knee bend. Now the exercise we're going to be doing takes our thoracic spine into extension over the top of our roller and then brings us back to our start position. As we go down and arch, there's the extension of the thoracic spine, and then we bring ourselves back to neutral. Now before we start this, we want to make sure that we're in a neutral lumbopelvic alignment, so we're thinking of our Pilates center. And if you're not sure on that, take a look at my video on the rest position, because the same principles are deployed. Your body is going to follow the path of least resistance when you attempt this exercise, particularly if you've not done it before. We want to dissociate the movement of the thoracic spine from that neutral lumbopelvic position we've established. So one thing which will probably happen to you, and I see all the time when I'm teaching this, is as you go down over the roller, the lumbar spine drifts from neutral, arches into extension and flares up, and it gives a full sense of movement. Now if you're on a roller, that's accompanied by your roller moving and rolling towards your feet, so that's the telltale giveaway. We don't want either of those two things happening. So visualize this 4-point unit between your pelvic bones and your ribs, and keep those two sets of points matched by keeping the rib cage pulled towards your belt line. This time, as you go down, you'll feel how you're having to keep that rib cage drawn towards your belt line with your abs to prevent that arching and unwanted movement. The other thing to avoid as you're going down is the neck drifting into extension and giving that false movement again. So keeping your neck still as if you're holding a tennis ball underneath your chin, and keeping that 4-point unit on the front tense with your abdominal muscles. You exhale, and then inhale to come back. Now by doing that, it means you're utilizing your abs, fixing the lumbar spine still, and then getting to what we want, which is our thoracic spine over the fulcrum of the roller, and that's where you get that lovely mobility. Now we've started further up towards the upper thoracic spine, because if you started off right down in the lower thoracics, in that kind of lumbar thoracic junction, there's an awful lot of leverage kicking off this side of the fulcrum underneath you, and it might be too much for you. It can be quite a sudden change. So instead of doing that, we start at the upper thoracic, and if we want to, we simply bring the feet a little bit closer towards us and then roll up, making sure that I don't go off camera when I do that. But there would be the nice technique, and you can literally go down 1 or 2 segments of your spine at a time. So once you're happy and proficient with the upper thoracics, you'd roll 1 or 2 vertebrae, fix, draw in through those deep abdominals, inhale, prepare, exhale, inhale back. And it really is about keeping that isolation in your lumbar spine. And you want to get to that point where the end of your range of movement, you're feeling like having to really utilize that abdominal contraction to hold that static position and get that lovely extension. And then back. If everything's fine there and there's no apprehension, you can gradually work your way down to that lower thoracic spine, somewhere around the 12th rib. And this time as you're going down, it's going to be much more difficult to stop that lumbar spine popping up. Okay, we're just really trying to keep that abdominal tension. And then as you come back up, it's the utilization of all of that anterior segment to bring you back up into your start position. So hopefully it's clear by now that what we're trying to do is mobilize the segments of your spine that sit over your roller or your fulcrum without letting other things move in place. And because the thoracic spine will be habitually quite stiff in a lot of you, that's where the false neck movement and the hyperextension, the overarching in the lumbar spine will happen if you allow it, and it will happen very quickly. So keep that control, keep that engagement of the abdominal unit between your ribcage and belt line, and keep that ribcage anchored the same distance from your belt line. And then as you go down, enjoy and feel that slight challenge you've got by holding that tension and then moving into the stretch position. As for how long you can go into that stretch position, well, really discomfort or pain would be the ultimate limiting factor there. If you're down in your extended stretch position and you begin to feel apprehensive, well, you've probably already done too much. But if you feel happy, you can certainly spend a bit of time down there. Inhaling to hold the stretch position, exhaling to go again and holding, making sure you're zipped up between that ribcage belt line unit. Inhale, hold, exhale down is a nice variation. And then draw your chest and ribcage back to the start. Don't pull on your head with that one. Now, a lovely variation which gets a little bit more towards hard work and things like our oblique prep is we can take ourselves down on a little diagonal, a little rotation. So you probably want the roller a little bit further down towards your mid-thoracics for this, just to be able to get the necessary mobility. But this time, I'm going to go down into my extension pattern and try and rotate my torso across to the right. So my breastbone is coming across as I drop. When I come back up, I'm going to draw my now lower right shoulder girdle back up towards my left hip. And there's our oblique prep variation. And we can go again, dropping down, getting that lovely rotation. Be careful not to wrench your top elbow across your body or twist your neck aggressively here. We're looking for the thoracic rotation. Try, if you can, to keep that neutral lumbar spine and then coming back up. If I come to center, we can just as well do the other side. And drawing that shoulder on the oblique axis towards that opposite hip. Exhaling as we go down. This one I inhale at the base, exhale for the oblique prep coming back up. Have some fun with this one because when you're coming into those angles, you can unlock all sorts of wonderful range of movement. Our thoracic spine has as much propensity for flexion and extension as it does rotation in each segment. So we've got to work into that rotation as well with that oblique variant to really maximize the range of movement that we're going to try and establish here. We're also focusing on control. Through all of Pilates, you want to have that notion of good control, slow, intentional movement, and make sure you're not whipping into those potentially problematic positions if you're not used to it. You're also going to get some lovely abdominal work. So the further you go down, the more that anterior wall of your torso is going to have to bring you back up. So that's why we start at the upper thoracic, work our way down, and then bring in those rotational oblique variants for those who need them. Anyway, I'll talk through and show you some of the other bits of kit which you can use here, but there's the basic technique for using your Pilates principles to really get some fantastic mobility through your thoracic spine. So I've raided my Pilates toolkit again, and I've gone straight in with something which a lot of you won't have. It's a Pilates wheel. Some of you would refer to these as yoga wheels. Very strong polycarbonate shell with a nice comfortable lining. This one is of course a little bit more kind of challenging, but the same principles can be used if you want to mobilise over your wheel. Now for those of you who maybe have only just come across one of these or using it for the first time, they do have a lot of tendency to rock side to side, so this is why it's a little bit more of an unusual item. And there are a couple of ways we can do this. The first one is from the sitting position, which is definitely the most secure and the kind of safest way to go about it. And we can do exactly the same technique. From our start position, we think about engaging through those abdominal muscles to fix our neutral lumbar spine. Inhale, prepare. Exhale, and you're going to try and take your thoracic spine down onto your roller. A lovely feeling if you've got one of these. You're supported, you're bringing one joint down at a time onto your wheel, and then really working to keep that control to stop your lumbar spine popping up. Really, really nice feeling. The more advanced version, this is definitely only if you're well used to using them, is to bring your hips up away from the mat, making sure you feel very centered on the wheel. From your start position, we can again drop down and come back up. Now for those of you who have a lot of mobility in your spine, you can't actually allow the lumbar spine to drop into extension as well on the wheel. And you can get some really nice curvature, some lovely extension, and that feels really very, very nice. Now of course, if you're using a wheel and you're doing that final variation where you're getting your full extension of the whole spine across the surface, and that's really just for people who have no problems or contraindications which would prevent them from doing those techniques. But for those who can, great. Back to where most of us will be residing though, you could use a balance cushion. Classic balance cushion which you use for standing balance exercises or core stability exercises, and coming down. Still getting me some really nice challenge to hold that lumbar spine as I go into my extension. We can use any sort of exercise ball or a football, something which will probably be a lot more comfortable than some of the other objects. And coming down, you can see exactly the same technique, and this would be a really nice core stability challenge if you decide to do your obliques, coming into that extension and dropping down, because this time we've got the tendency to roll off the ball, and I'm really having to get some good control through my core to prevent myself slipping and rolling off the ball. Failing that, if you don't have any of those bits of kit, get a towel, quite a big one, roll it up. It probably wants to be kind of 4 to 6 inches in diameter, fairly closely packed once you've rolled it across your mat, and that will serve just as well as any of these. All these little things each have their pluses and minuses, and you'll get different feel from each, but essentially anything that acts as a fulcrum to push that spine up and allow it to extend over the top of it. That's what you're aiming for, and that's why I love this exercise. It's very versatile. You can use lots of different pieces of equipment, and even 2 pillows stacked on top of the other. I know I'm kind of coming up with all these harebrained suggestions, but the point is we want to get that spine going into extension. Everything we do kind of pulls us down into this flexion curve, back into this kind of fetal position. We then get that horrible chin poke posture and association with it, and we need to mobilise that thoracic spine. If your thoracic spine is stiff, it causes all manner of problems through your legs, down into your knees, and it's really not a good status quo to have in your body. So this exercise, I think, goes a long way, and all the variation we've done into getting that mobility back and really waking up that important structure in your body.